This is the case of Mr. Yang, 57 years old. So, meron siyang first consultation, May 14. Ang complaint niya, meron siyang lower limb edema and feet numbness for over half a year. Sa history, medical history, the patient suffered from lower limb edema and feet numbness for over half a year na nag-worsen when standing for long period of time. He was diagnosed with weakness of the kidney and was hospitalized without any curative effect. Sa May 9, he was hospitalized again due to relapse of lower limb edema. He was treated by prednisone, albumin, and so on. He was discharged after the symptoms resolved. However, the edema occurred again 5 days later and came for treatment. The patient had a history of dilated cardiopathy and cardiac function grade 3. So he took digoxin and cordarone daily. Ang presenting symptoms niya, meron siyang mental fatigue, general edema, especially in the lower limb, feet numbness, burning heat sensation in the left sole, dry mouth, scanty and clear urine, pale dark tongue with teeth marks with a white tongue coating and a deep and thin pulse. Sa physical examination, pitting edema in the waist, sa back, meron din, and in the lower limb below the knees. Dilated heart edge to the left. Regular heartbeat, 64 beats per minute. Urine routine test. Ang protein niya, +4. UPQ, 7.9 grams every 24 hours. Yung blood test niya, yung total protein is 32 grams per liter. Yung albumin niya is 20 grams per liter. Yung BUN, 9.2. Yung creatinine, 161. So, may elevated. Pattern differentiation nephrotic syndrome pertains to edema in the Chinese medicine, which has a close relationship with the spleen, kidney, lung, and sanjiao. The spleen is the earth organ and the foundation of acquired constitution, while the kidney governs the Mingmen fire and is the foundation of congenital constitution. The transformation and transportation function of the spleen depend on the warmth of kidney yang, and in turn, the kidney essence lies on the constant replenishment of food essence transformed and transported by the spleen. So there is nagdi-depend yung spleen sa kidney and yung kidney naman sa spleen. Thus, these two organs supplement and promote each other. If the spleen yang is insufficient with weak function of transformation and transportation, then the food essence production will fall short and it inevitably lead to kidney essence insufficiency and failure of the spleen to control water manifesting in general edema, especially in severe lower limbs. Yung feet numbness and burning sensation in the left sole are signs of obstruction due to stasis. The symptoms of dry mouth, a pale, dark tongue with teeth marks and a white tongue coating, and deep and thin pulse are signs of obstruction impairing the passage of body fluid. In this case, the disease location is in the spleen and kidney with a root deficiency and branch excess. So, combination of deficiency and excess. Ang diagnosis niya is edema due to spleen and kidney deficiency with stasis impairing the body fluid passageway. Sa Western medicine diagnosis, nephrotic edema. Sa treatment, in this case, the pathomechanism mainly lies in dampness retention due to spleen deficiency causing the stasis obstruction, impairing the body fluid passageway. As a result, it manifests as general edema, especially severe in the lower limbs, with numbness and burning sensation on the left sole. So, treatment principles, we have to fortify the spleen to promote urination. Warm qi to drain dampness, dispel stasis, and nourish yin. So may mga formula.